Hello, my name is Kristen and I'm a registered physiotherapist. Welcome to this movement practice for body mapping sitting rotation. This movement practice is designed to improve body awareness and retrain the motor maps in the brain to help ease tension with sitting rotation. To begin, find a comfortable place to sit where your feet can rest on the ground. Take a moment to just center yourself in your seat. And when you're ready, just try your rotation towards the side, noticing how far you're able to go and noticing the tension that you might feel as you turn. Remembering how that felt, we'll come back and check in on it near the end. Now, just trying to do a bit of turning towards the one side. Let's start towards the right. Turn towards the right and go and stop just when you feel the tension build and then come back towards the center. Turning towards the right, just going within your comfort zone and stopping and coming back to the center when you feel that tension build. Just noticing how that feels, not going to your extreme end, just staying within the range of motion that feels comfortable and easy. Start to try to time your breath with this by breathing in when you're in the center and breathing out as you twist. Breathing in, returning towards the center, and breathing out as you turn. Come back to the center, and now turning your head and your body, but keeping your eyes straight ahead. Keeping your eyes straight ahead as you turn your head and your body. Again, breathing in as you come to center and breathing out to turn. And just noticing how that feels. Stay within your comfort zone. Eyes stay straight ahead as your head and your body turns, exhaling as you turn. It's perfectly normal for this to feel a little bit funny and difficult to coordinate. Now, keeping your head and your eyes straight ahead, turn again to the right, only turning through your torso. Just noticing the sensation that you feel through your mid-back. Notice how the shoulders kind of move through space. As you turn towards the right shoulder goes back and the left goes forward. And notice how the hands kind of want to follow that. Exhaling as you turn, keeping your head and eyes straight ahead, working on just turning through the torso and the shoulders. Allowing the hands to follow. Now, keeping the head, the eyes, the torso stable as you turn from the hips. So turning towards the right, push the left knee forward and right hip back. And just notice that gentle shift through the pelvis as the left knee comes forward and the right hip goes back. Keeping your breathing even. Trying to exhale as you do the turn. Good job. One more time. Now let's put all of that together. Initiating the movement from the bottom up so that the whole system, the hips, the torso, the shoulders, the neck, the eyes participate. Taking a breath in to prepare. Breathe out, pushing the left knee forward, right hip back, turn through the torso, turn through the shoulders, turn through the neck, and turn through the head. And then breathe in, come back towards the center. Breathe out, initiate from the bottom, through the torso, through the shoulders, through the head, the neck, the eyes, and letting the hands slide. And breathe in, come back to the center. Moving through the whole system, from the bottom to the head. Initiating from the hips and pelvis, torso, shoulders, neck, and eyes. Inhale to center. Exhale to turn, initiating the movement from the bottom to the top. Now let's work on the other side. Same thing. Start by just doing a little bit of a turn, staying within your comfort zone. As soon as you feel tension begin to build, that's as far as you can go. And then come back. Turning towards the left, staying within your comfort zone, and as tension builds, come back to center. Keep the eyes facing straight ahead. Turn through the head, the torso, but keeping the eyes straight ahead. Exhale to turn. Inhale to center, eyes stay straight ahead. Staying within your comfort zone, turning through your torso and your head with eyes focused straight ahead. Coming back to center, now keep the head and the eyes straight as you turn through the torso only. Allowing the torso to learn how it can turn by itself. Feeling how the shoulders move in space. As you turn to the left shoulder goes back, the right shoulder goes forward. And you can allow your hands to slide on your lap if that feels okay for you. Pausing in the center, now let's work on the rotation from the hips. As you turn towards the left, push the right knee forward and left hip back. Initiate the movement from the hips and the knees. As you turn to the left, the right knee pushes forward. Now let's try the whole movement, initiating the movement from the bottom, the pelvis, out the way to the top, to the eyes and the head. Breathe in to prepare. Breathe out, turning towards the left by initiating the movement, the right knee going forward, and then allow the torso to turn, the shoulders to move in space, the head, the neck, the eyes. And then coming back towards the center. Breathing in. Breathing out, initiate from the hips and pelvis, turn through the torso, the shoulders move in space, eyes and neck follow along. Exhale as you turn, hips, torso, shoulders, neck, eyes. Inhale back to center. Allowing the hands to slide as the shoulders move through space. Now let's alternate sides, breathing into the center, breathe out, turn to the right, initiating the movement from the hips, the torso, the shoulders, the neck, the head, the eyes. And coming back to center on a breath in, and breathe out, initiate to the left from the hips, the torso, the shoulders, the neck, the head, the eyes. Inhale to center. Try that a few more times. Thinking about initiating the movement from the lower half to the upper half, from the hips to the pelvis, all the way up to the neck, the head, the eyes. Inhale to center. Exhale to turn. Initiate from the hips, the torso, the shoulders, the neck, head, and eyes. Inhale back to center. One last time. And now notice, how does it feel to turn right and left? Now that you have educated all of the different parts of the body to participate in the turning, does there feel like there's a better quality of movement or less tension, or can you go farther? Use that information to continue to guide your practice. Thank you very much.